So today we have a 62-year-old white female who come in the clinic today with a chief complaint of her blood pressure bottoming out while she bent over to give her husband a kiss goodnight before going to bed. She states that her blood pressure dropped to 83/54 last night. She states that when she bent over to give him a kiss and got up quickly, that she felt very dizzy, but she did not lose any consciousness. She stated that she had to sit down for a few minutes and that she did feel better shortly. She does not have any allergies. Only history that she has is hypothyroidism. She's had a stroke in the past, and she is obese. Surgical history, she's had a bariatric surgery in the past, tubal C-section, hysterectomy. She's had a C2 through T2 fusion and a C4 and C5 disc excision. Patient reports occasional alcohol use, no tobacco or recreational drugs. She is married and she is a teacher at the school. Up to date on all age-appropriate screenings and all age-appropriate vaccinations. Medication-wise, she takes meloxicam, cholecalciferol, ezetimibe, folic acid, Tylenol, Sanaflex, and MP-thyroid. Upon her review of systems, she denies any lightheaded or dizziness in the office. She is alert and oriented, denies any cardiac or respiratory issues. She is alert and oriented, denies any urinary or abdominal issues. She moves all extremities, and she just has limited range of motion in her neck where she was fused. Physically, and upon her physical exam, we did take her vitals and we did orthostatics. Sitting, her blood pressure was 124/74, heart rate 63. And then standing, her blood pressure dropped to 100/60 with a heart rate of 65. Respiratory and CV were all normal, and she remained alert and oriented. So diagnosis-wise, we thought it was most appropriate to diagnose her with orthostatic hypotension, and this is characterized by a sudden drop in blood pressure by at least 20 millimeters of mercury systolically or 10 millimeters of mercury diastolically within 3 minutes of standing or sitting. In our patient's assessment, her diastolic was noted to drop by about 24 points, which is considered orthostatic. So for our plan, nothing is prescribed at this time. We did order a CBC and CMP to check her labs. We did educate her on nutrition, physical activity, and sleep. Referred her to cardiology to make sure it wasn't a cardiac issue. And then for family and patient education, we educated her on what orthostatic hypotension is and what can cause it and how to treat it. We educated her on hydration, to change positions slowly, and that if her symptoms persisted or if they worsened, to go to the ER. And then, of course, to follow up with the clinic if she needed to, of course. Two other differentials that we discussed would be hypovolemia or dehydration, which we did send labs off so we could see if that could be a cause of this. And then, of course, medication-induced hypotension, which the patient was taking blood pressure medicine before her gastric sleeve, but currently has not been on medications. So that was less likely the cause of her hypotension at the time, and less likely the cause of her dizziness and drop in blood pressure. So we obviously went with orthostatic hypotension, and discussed the risks and causes of that and how to prevent that. And we will follow up on the plan and see if that will get better with her. Thank you.